A respiratory virus spreading across China and India is making for concerns here in the U.S. The virus is known as HMPV, and we're seeing an increase in cases here in the Southwest. To tell us more, we welcome former State Health Director Will Humble, Executive Director now of the Arizona Public Health Association. Will, good to have you here. HMPV, what is that?
Yeah, it's a virus most people have never heard of. It's like RSV. Most people have heard of RSV, respiratory syncytial virus. It's like that. It's in the same family. And it causes really similar symptoms. And so it's like a really bad cold virus that creates lots of congestion, not necessarily fever, but a lot of just head congestion, but also in the lungs too. So That's why it can be dangerous for the same people we've been talking about. People my age and older and little kids, people with other kinds of respiratory problems. And it can cause pneumonia, because of the secretions that it creates.
It sounds very familiar to a lot of folks.
Yep.
I mean, I think, and this is going around, isn't it?
Oh, it certainly is. It's not reportable like influenza, for example, so the data isn't great, but there are some labs that voluntarily turn in their data from the specimens that they test, and that's the data I put up on my blog that you can show, at least in the Western U.S., it's going up a lot. So this isn't just India, China, this is happening here too. And I think it's special people are talking about it because it was that first epidemic was really in Beijing, and everyone's like, oh no.
Yes.
Yeah.
But we shouldn't be saying oh no for this one?
Well, it's a really bad cold. It's like RSV. The difference between this and RSV is RSV has a vaccine, which you and I have had.
Right.
The vaccine. This does not have that. So it's you try to prevent people from getting pneumonia and supportive care and that kind of stuff.
Heard about complications, pneumonia, bronchitis, asthma, flare-ups. I've also heard like ear infections. What?
Well, it's because the congestion that's in your head.
Okay,
all
right.
So it gets in eustachian tubes, it gets in, so that's related to that.
And again, how contagious?
It's like RSV, so droplets, particles, hand washing, like influenza, same kind of thing. It's not rocket science.
I also read similar family as measles and mumps even. I mean, is that true?
The symptoms are way different.
No, not the symptoms, but the virus itself.
The virus itself, similar.
Okay.
Not as contagious, though. Measles is it's off the charts contagious,
right.
So it's not like that.
Okay. I may have misread that. So RSV, we're hearing a lot of RSV here. The RSV vax, you referred to that. Could that vax be helpful against this?
No. So
Why?
It's just too different.
Okay.
So the antigens on the surface are just too different. So even though it's a similar virus, it doesn't provide protection. But for this virus.
Same family, but they don't talk to each other. Is that what you're telling me? Okay. Will it become more prevalent in the U.S. here over the winter, do you think?
Well, it's already, based on the limited data that we have, we can see it cycling up. It's hard to tell, but I think this is going to run through the country. And like we talked, I think, last year about RSV was off the charts last year.
Yeah.
Remember that?
Yeah.
This year, there's some RSV out there, but not very much. Why? Because people were infected last year, it gives you residual antibodies for this year. So I would expect if this pneumovirus takes off like I think it's already has, because I think I had it, by the way, we'll see less of it in future years, in the next couple of years, because people have protection, natural immunity.
In terms of hospitalization, compared to COVID, compared to the flu?
Don't have enough data to say.
Okay.
Because it's not reportable. So we're getting sporadic from
voluntary
reporting from certain kinds of labs. So you could get like the basics of it, but it's pretty primitive data. So we can't establish a tie between this and hospitalizations. With influenza, we definitely are seeing an increase in hospitalizations.
Let's get to influenza. Let's get to the flu. What's going on out there? Because it seems like that's starting to pick up. It is. It
has been picking up a lot since probably mid-December, and I don't know where it's going to peak. It's still in the acceleration phase. So that's why I said in my tweet today, like procrastinators, it's almost pretty much too late. So, if you haven't been infected yet, go down there and get it because it's gangbusters right now. Influenza, not RSV is not, though.
Yes, and HMPV really isn't going gangbusters like the flu, correct?
It's like we can't.
You just
really
don't know.
say.
Why don't we? Can't we do a better job of that, Will?
Well, it's just not reportable. So you have to mandate reporting in order to get people to turn that data in and do the tests. But you shouldn't report for reporting's sake. Like, it's important to make sure that you only ask people for things that you really need. Data for data's sake is not a good policy.
Don't want to ask for too much. Yeah.
Only ask for what you need, and I'm not so sure we're in the stage where we need to actually make this a reportable illness. Time will tell if we see a lot of inpatient hospitalizations from it. So far, the data's picking up that increase in hospitalizations from influenza, but not RSV, and also not COVID.
Yeah. Bird flu cases. CDC, I think today put an alert out on bird flu cases because there were a couple of cases for people that tested positive, no known exposure to animals. Is this still kind of simmering as opposed to being a major issue, the bird flu?
Oh, yeah, for sure. It's mostly an occupational hazard right now. So
interesting.
So people who work in like the dairy industry or work with bird flocks and that kind of stuff, they're the folks that are most exposed. They found it in the sewers here in Maricopa County. I think that's backyard flocks. People's backyard chickens that they were cleaning in the kitchen. It ends up in the sewer that way. H5 isn't, at this point, not in the same league of the other things we've been talking about so far.
Last question here. We've gone all this way. We haven't mentioned COVID really specifically. What's going on with COVID?
It's less than it was this time last year. We had a pretty sizable infection amount last year that could be giving some people some residual immunity. Also remember, people who, whether you've been infected or vaccinated or not, people been infected with the virus multiple times, some of them. I mean, I've had probably 6 vaccines, I think, and I've still got the illness once. So that immunity is beginning to continue to build. So it dropped, by the way, COVID dropped way down in terms of causes of death this year. It used to be in the top, well, as you remember, it was the top leading cause of death. And for 2 years, it was the 3rd leading cause of death in Arizona. Then it went down to like 8th, and now it's off below 15.
All right. So we'll keep an eye on HMPV. Will Humboldt, Arizona Public Health Association. Good to see you.
My pleasure.